one of these before?
Oh, that's the Biodex.
That's right, that's a Biodex or an isokinetic device. You won't see these many more. Nobody's buying them anymore. These cost like $40,000, $50,000. And most of the time they're just taking up space in the clinic. But yes, this can measure peak torques and all kinds of different things, different velocities, all stuff. We'll talk more about that later. But that's what they look like. Extension lag. Anybody heard this term before? Okay, so if you got somebody, you're trying to get them to do a straight leg raise, the knee completely straight, and they can't do it, and they have to bend their knee to lift their leg, that is called extension lag, okay? Usually indicative of VMO weakness. Sometimes it appears because people can't get into full extension, so it's a joint problem. But more times than not, it's got to do with weakness. So what is this person going to walk like?
Like they're about to give out.
This person doesn't trust their leg, it's weak, can't get to full extension, so they're going to have this little, you see it all the time. And it makes you mad as a therapist when you see somebody who has a total knee replacement and they present like this and you're like, you had knee surgery, but yet you don't want to work hard enough. It's crazy. Okay, knee girth measurements, important. Again, this is why you've got to be able to find that joint line. So you do not get to draw on your patients like this. But it is helpful. You can put a little mark where the joint line is and so forth. So you can measure at the joint line. You can measure 10 centimeters above. This one looks like about 6 inches above. You can measure the calf and the gastroc. Again, you can measure to show atrophy in the quadriceps or in the gastroc, or you can measure to show swelling in the knee. But girth measurements are very common, especially for post-operative knees. Who's got a tape measure out? Anybody got one? No. There you go. So the way to do this, can I borrow a knee real quick? And look like you're somewhat skilled at it, is, let's do this side, is measure in centimeters because it's more precise. So I would measure joint line, and then if you want to measure above, you're going to take it and mark it beforehand. Mark, say 10 centimeters here, I put a little dot there, and then you're going to measure joint line, 10 centimeters above, 15, whatever you want to measure here, do that. But keep the tape measure there. Don't take it out, go write it down, and then have to do this again and all that stuff. Just much smoother if you just keep the tape measure there and just make room for it. Thank you. Is this yours?
Yes, Dad.
Oh, here we go. This is the one I will not be demonstrating. Teller apprehension test. Remember, we had a shoulder apprehension test, right? It's the same thing. If you put your hands like that on my knee, I will punch you in the teeth. That is exactly the way I dislocated. So that is a no-go for me. But a positive finding is someone's apprehension. Okay, it's not about how far it goes or anything like that. But you get somebody who's dislocated, they are going to beware. Willamette and tap sweep test. All right, so what you're doing here, I'm going to use you for a couple of these tests since you're already here. Maggie's probably going to have a positive on this one, I'm guessing. So what you're trying to do is you're trying to take the joint capsule and isolate it. Let me do it on this side so they can see this. You're going to squeeze it, and then you're going to tap. Because if you've got swelling under here, your patella will just float. And you'll be able to tap it like this. I have a positive on this one. So that is a ballotable tap and sweep, all those kind of things. Nope, you're good.
This side's good too.
So you get somebody with a bunch of swelling, you do that, and that patella will just rise right to the top. We'll go over a couple of these and then we'll practice them. So apprehension, lateral, medial, lateral grind test. You're gonna take I'm gonna put my finger on the joint line. We're gonna do another one called McMurray test. It's very similar. And you're just gonna go to like figure eights here and see if we can get, you might have a positive on this one with your crepitus. That was in your ankle though, wasn't it? So we got nothing there. She's good. And that is positive for meniscal tear. If you get that pop and click there, that's gonna be positive for meniscal tear.
You might be positive on that.
Tell her ground. Not many people like this one. Sorry if this hurts. So what I'm gonna do is I'm gonna take my hand and I'm gonna push downward this way, above her patella, and then I'm gonna have her contract her quad. That doesn't like, you don't like that one? No, not many people have this and that don't have pain. Because what that's doing effectively is compressing the patella, and then when you contract that quad, it's gonna bring it back and have it grind along the backside of it, along that femoral condyle. Clark sign is usually, this is positive on more people than it's not. And I think you just go on degrees of it more than anything. Indicative of chondromalacia, remember the backside of the patella. Is that 4? Yeah, that's 4. Let's go practice 4 of those. We got lots of these.